Welcome to today's lecture on the urinary system. So we're going to take a look at the functions of the urinary system, how they affect the overall body, some common pathologies or issues that kind of happen within those systems, and therefore what the possible impact or no impact some of these will have when it comes to massage. So this should give you more confidence around understanding the system, how it integrates with the body, and more importantly, what it's going to mean to you. So let's get into the nuts and bolts of the urinary system. So what are the organs involved and how does it work? So let's start with the kidneys, which most of us are familiar with. We generally have two of these, one on each side, and they are found generally between the vertebrae of T12 and L3. So quite low on the torso of the body. They're bean-shaped organs and they have an indentation on the medial aspect, and it's through that indentation that the various arteries and veins come in and out of the organ. So the renal artery, the renal vein, the lymphatics and the nerves enter through that indentation, and it's called the hilum of the kidney. The kidney is then enclosed within a renal capsule, an adipose capsule, and finally the renal fascia. So that connective tissue that we're always talking about is that final layer that connects it within the body. We then have layers and layers of collagen fibers that anchor the kidneys to the surrounding tissues and structures. So they're not just floating there and they're not going to sink around. We do have these structures and tissues around it to give it some support, structure, and position. The kidney has two distinct parts, the outer cortex and the inner medulla. So if we look at the second diagram here, you'll see that within the kidney in a little bit more detail. So the medulla has 6 to 18 conical structures, and these are called the renal pyramids. The apex, or the point of these pyramids, is called the renal papilla. The urine is created in these pyramids and drains through the papilla into cup-shaped structures, which are called the renal calyces. And these join at a junction or structure, which is called the renal pelvis. So you'll see that term renal pelvis used quite a lot, but we're not talking about the pelvis, the bone, it's within the kidney itself. So looking again at the renal artery and vein, the renal arteries are branches of the abdominal aorta, and they supply the kidney with about 20 to 25% of the total cardiac output. So really, really blood-rich organ, which makes sense after we talked about the functions. The renal artery enters at the hilus and divides and redivides into a number of afferent arterioles. These arterioles reach the renal corpuscle to form a network of glomerular capillaries. So as with the rest of the body, those arteries get broken down into smaller and smaller pieces so that the functions and jobs can take place at a smaller level. The blood from the capillaries leave the corpuscle via the efferent arteriole. And these efferent arterioles descend downwards in a loop and form capillaries again. So it always reminds me a little bit of the lungs. There's definitely, some structural similarities between the two in terms of this exchange of various fluids. Gases in the lungs, fluids in the kidneys. And it's these capillaries and these loops that allows us and where these substances can be reabsorbed or secreted from the renal tubules into the blood and vice versa. So where this exchange can take place. So looking back at the first diagram, so coming out of the kidney, we then have the ureter. And these are muscular tubes that extend from the kidneys towards the bladder. So for transporting that urine away. So going back to our muscular modules that we looked on, those walls consist of smooth muscle, which we know works autonomously, so subconsciously, and helps to keep that urine moving from the kidneys and towards the bladder. Again, it's not just floating and hanging around there in space, it's connected to the posterior abdominal wall by fascia, and it runs over the psoas muscle, so a muscle that you will be becoming a lot more familiar with through this course. Finally, we come down to the urinary bladder, and this is where the urine is held temporarily before we excrete it from the body on urination. It's a hollow muscular organ which is connected to the pelvic cavity by connective tissue. That smooth muscle again, but that's within the bladder, is called the detrusor muscle, and it's arranged in 3 layers: the inner, the outer, outer longitudinal, and the middle circular muscles. So the entrance and exit of the urinary bladder consists of this circular smooth muscle, which is called sphincteric muscle. And we talked about that in our muscle module as well. So again, looking at those holes where contractions and relaxations will open and close various orifices. We then, at the very end, have the urethra, and that extends from the neck of the bladder to the external urethral opening. In a man, that urethra is 18 to 20 centimeters long, whereas in a female, it is just 2 to 5 centimeters long, and hence why women have an increased risk of UTIs. The urethra passes through the pelvic floor in both men and women, and hence why the pelvic floor can have an impact on its function, and why it's an important player when we start to look at things like urinary incontinence. Taking a quick look at the functions of the urinary system, you can see that it's actually involved in quite a lot of key functions in the body. So the first one, which is an obvious one, is elimination. So as we eliminate the urine from our body, we pass with it not just water, but also some waste products or byproducts of metabolism within the body. And these are things like salts, toxins, along with the water itself, and we eliminate that as we urinate. On the flip side of that, it's not just about elimination, but the urinary system also helps us to conserve key nutrients. So as the urinary system processes the various fluids and salts in the body, it conserves critical nutrients by ensuring that they are not eliminated. So for example, to help store glucose and amino acids. Next up, in terms of blood, it has a couple of roles. It helps to regulate blood osmolality. And this is where it separately regulates the loss of water and the loss of solutes within the urine. So this is how the kidneys maintain this relatively constant blood osmolality or electrolyte balance to ensure that the right levels are being kept at all times where possible. So if we have these things within our body, making sure that we don't eliminate too much, but that we eliminate enough that we don't become toxic or overstore certain electrolytes. The knock-on impact of that is that we also have the urinary system regulate blood volume. So by conserving or eliminating water, the urinary system impacts the blood volumes within the body. And that in turn regulates blood pressure. So there really is this link between the kidney function and the urinary system and the blood, okay, and blood pressure within the body. Again, the next one's kind of obvious given what we've talked about, but it's key to regulating the levels of various ions within the body. So things like sodium, potassium chloride, calcium, and when there are excess ions present, they quickly get passed out through the urine. Or if they're too low in volume, the urinary system steps in to reclaim these. So it's really key. It's like the guardian of the various ion levels within our body. The knock-on impact of that is that it's critical to regulating our pH balance. So as a result, a direct result of processing and regulating the water and salt levels in the body, the urinary system can eliminate large volumes of hydrogen ions, which helps to regulate the pH balance. And pH balance is really important to overall well-being and health because as we know, a system that's too alkaline or alternatively too acidic, more to the point, can cause problems within the body and cause us to lose that homeostasis. So the urinary system also integrates with the hormonal system or the endocrine system because it does have an endocrine function. So the urinary system releases 2 key hormones. So the first is calcitriol, and that's an active form of vitamin D, which leads on to the final point there, that where it's critical in the formation of vitamin D. So it's through this hormone, and it helps to regulate calcium homeostasis. So that's really its role within that and the formation of vitamin D. But it also produces or releases the hormone erythropoietin, which helps in the production of red blood cells. So again, you're seeing this tie back to the blood and circulatory system as well. take a look at what the urine's actually composed of. So 97 to 98% water, which is an obvious one, but it also contains organic substances, and those include urea, creatinine, ammonia, uric acid, urobilin, and bilirubin. Urine contains glucose in minute amounts, but if blood glucose levels are high, then the kidneys cannot process it. So, for example, when we start seeing kidney dysfunction in diabetics. Again, red blood cells should not be found in urine, and when they are found, they're generally indicative of a problem. So, for example, an infection. The pH ranges from 4.5 to 8, which is quite a lot, but it kind of makes sense when we've gone through the functions because it depends on the volumes of elements it's secreting at any one time. And finally, urine is sterile unless contaminated by bacteria in the external genitalia. So how does the urine get produced? So blood enters the glomerulus within the kidneys. So it comes in via the renal artery and flows to the afferent arterioles that we talked about and into those glomerular capillaries. And this is where the first step takes place, which is the filtration of wastes. Under high pressure, the waste substances are pushed out through the membranes of the capillaries and into the Bowman's capsule. This includes water, glucose, amino acids, and fatty acids. And some of these items are needed by the body, so get reabsorbed later down the line of this production system. So we then move on to the next step when we've done the filtration, and this is where we have selective reabsorption. So the cells of the renal tubule have the ability to reabsorb, and this is for useful elements, but can also be used to secrete waste materials that were not removed in filtration. So the urinary system really has this bi-function of excretion as well as reabsorption. So having that understanding that it needs to know what's going on in the body to constantly know what to keep and what to get rid of. That rate of absorption of water and electrolytes is monitored by hormones. Hence that key tie-in with the endocrine system. The next step happens, and that's secretion, and that's also available within the renal tubules. So it's a critical process to help remove further waste from the blood and helps to reduce the overall toxicity of the plasma as it passes through the kidneys. So it's not a one-stop shop. Wherever it can, it will excrete more where needed to. And finally, excretion, and that is the final step in that production system of the urine, is we excrete it from the body. So we've touched on this quite a bit, but it's worth spending just a couple of minutes to see how does the urinary system integrate with the other systems of the body. So first of all, looking at the cardiovascular system. Because the kidneys increase or decrease the reabsorption of water filtered from the blood, the cells in the kidneys release renin when the blood pressure decreases, which helps to regulate the blood volume and blood pressure. And this is going on constantly. So the kidneys are constantly working with the blood to keep those levels at the right levels. It also has a digestive role. So we talked about this synthesis or this creation of the hormone calcitriol, and that's the active form of vitamin D. Synthesized in the liver, it is necessary for the absorption of dietary calcium. So if we're eating calcium-rich food, it's not doing us any good unless we have that calcitriol, which helps us then to absorb and use that calcium. So it works hand in hand with the digestion of those foods to make sure that we can absorb what we need. We then have the integration with the endocrine system that we've touched on quite a bit. Again, that synthesization of the vitamin D, calcitriol, but also the kidneys release erythropoietin. And, that is really key to the red blood cell production. So we've got these two things going on. So one, we need the calcium for the bones. So that vitamin D, calcitriol, is really important. But erythropoietin is really, really important from a cardiovascular point of view. And finally, one we haven't talked on as much, which is the skin. So the kidneys work with the skin, not just alone, to synthesize the vitamin D. And again, also helps with fluid balance necessary for perspiration. So again, because of that elimination and because of monitoring the water levels, it's working with the sweat and with the skin. So when it can't get rid of enough fluids, then it can work with the skin to stimulate sweating and eliminate more where needed. It also plays a role with the muscular system. So calcium and phosphate, which we've talked about, how the kidneys regulate the balance of these levels in the blood, are really important for muscular contraction. So obviously too much, too little of these will have an impact. We also integrate with the nervous system. So the kidneys are responsible for gluconeogenesis. And glucose in turn is necessary for the production of endosine and triphosphate, which is found in the neurons of the body. In terms of the reproductive system, there's integration on both the male and female side in slightly different ways. On the male side, the urethra is a dual passageway for both the urine and also for the direction of sperm. Whereas in pregnant women, it's key to the elimination of the metabolic waste of the fetus. Because the urinary system eliminates wastes for both the mother and the fetus during that time. It has a role to play with the respiratory system. So by working with the lungs, it adjusts that pH level of the body and prevents abnormal function of enzymatic pathways. Finally, it has a role with the skeletal system, and this comes down to the calcium and phosphate again. So we're constantly creating new bone in the body, and we talked about that in our skeletal system module. And the kidneys help to regulate the level of the calcium and phosphate, so help the skeletal system to do that on a daily basis. So now, the bit you've all been waiting for, let's take a look at the various pathologies of the urinary system. So what you need to be aware of when you're massaging. And I think before we get into the details, as a general rule, acute is contraindicated. So for example, acute urinary tract infections, acute renal failure, acute stages of gout, acute kidney stone attacks, that word acute, we generally run a mile, isn't it? I think with all these modules we've done, if something's acute, we're not going to be working on that client. Also, due to the exposed position of the kidney, so we talked about it being found between T12 and L3 on each side of the spine, we need to make sure that we modify the pressure and avoid percussion around the lower back if anyone has any kind of kidney problems, not just acute. So the first on our list here is cystitis. And this is interstitial inflammation of one or both kidneys caused by a bacterial infection. Generally, it's felt as pain on urination. More common in women, as we talked about before, due to the shorter length of the female urethra. The impact is, sensitivity to frequent urination. So if it's acute, any acute infection, we're not treating them. But if it's not acute, we need to be sensitive. If our clients need to get up and use the bathroom within the massage session, make sure that they can and that they feel comfortable to do so. We then have glomerulonephritis, that's a mouthful, and this is where deposits of substances found within the urine can form solid stones within the renal pelvis, bladder or ureters. And this is generally symptomized by pain in the loins, high temperatures, shivering fits, so it can be quite acute. But we do get chronic cases, and in those long-term chronic cases of this condition, the kidneys become small and scarred, and kidney failure can ensue. So if it becomes a long-term problem, it really is a problem. So again, in those acute stages, absolutely contraindicated. Kidney stones, so where we have inflammation of the kidney, which resulting from causes other than infection. Okay. In those acute stages, it is very, very painful. It often needs to be removed by surgery. Massage is absolutely contraindicated. Next up is nephritis, which is also known as Bright's disease. In acute cases, there's blood found in the urine and fluid and urea retention that may lead to chronic nephritis and eventual kidney failure. So again, quite an acute condition, and if someone has acute nephritis, we won't be treating them. Gout. So this is probably one of the more common conditions. I've had several clients with gout over the years. and this is caused by a buildup of uric acid crystals around the affected joint. And this is generally where someone has higher levels of uric acid within the blood, and it starts to build up around those joints. So it can cause extreme tenderness, absolute agony, anyone I've ever known who's had this, and also a lot of swelling and visible inflammation around that joint. It's often found in the big toe or the ankles, but it's also seen in the wrists, knees, fingers, and elbows. So I personally have had clients with it in the toes, ankles, and elbows. And again, sometimes you'll see itching and flaking around the swollen skin around those joints. So sometimes if you spot these things, it's worth mentioning it to someone. Do they have any issues with that joint, any pain, just to bring it to their attention. So it's a local contraindication unless it's extremely acute, but you really need to support and protect the affected joint because the slightest touch can cause extreme pain to that area. We then have glomerulonephritis, and this is inflammation of the kidney again, but this time it involves the glomeruli. So this can cause blood in the urine in extreme cases, but what we see is that protein leaks into the urine, which reduces the protein levels in the blood, and this can lead to increased swelling or edema in the body. So it can be hard to detect. People may not know they have it. It's generally detected by a urine sample. So if someone tells you they have acute glomerulonephritis, then we are not going to treat them. We then have pyelitis, and that's inflammation of the kidney again, but this time within the renal pelvis and the calyces. When it's acute, it can cause complete cessation of glomerular filtration. So you can understand how dangerous this condition might be if we're not getting that filtration. But it generally happens after serious events. So for example, shock, after severe bleeding. We see this decrease in urination. And that can also be due to acute obstruction of the ureters or reactions to certain drugs. But what we see is this reduction in filtration and increased toxicity within the body. Again, if someone comes to us with acute pyelitis, we're not going to be treating them. Finally, on this page, we've got renal failure. And this is a chronic condition and it's very progressive. It's generally irreversible. And what we see is a decline in the glomerular filtration rate resulting from a chronic kidney inflammatory disease or condition. So, for example, chronic glomerulonephritis, pyelitis, etc. Again, massage is contraindicated as this is a very serious and life-threatening issue. We next have urania. And this is a toxic condition of the blood due to severe malfunction in the kidneys, and that results in increased urea and creatinine in the urine, and it's a progression from renal failure. So again, because it comes with that renal failure, it's very severe, causes weakness, fatigue, loss of appetite, nausea, vomiting, tremors, lots of nasty things, so it's a total contraindication for us. Urethritis, so again this is inflammation, but it's within the urethra, and that's generally bacterial infection frequently caused by STIs. Again, we can treat these people if they're not acute, but we just need to be sensitive to frequent urination and making sure that they have that opportunity to get up and use the bathroom before, during, or after their treatment. And finally, we have a urinary tract infection, so more common. Again, if this is really acute, they're probably not going to be coming for a massage, and we wouldn't want to treat them. But some people have these, they're managing them, they're taking medication, it's not acute, then we can absolutely treat those people. It's symptomized by a strong persistent urge to urinate, burning sensation before, after, during urination. And they tend to pass frequent small amounts of urine. So again, if someone's going to the toilet that often, do they want to be coming for a massage? Maybe not, but if they do, we just need to make sure we allow them to use the bathroom when they need to. So lots of information, lots of serious and less serious issues for the kidneys, but I think you'll notice there was a lot more serious pathologies in the urinary system than some of the others we've looked at, because it really is such a key system to the overall health in the body. And again, I think seeing how many systems it integrates with, that becomes pretty obvious. So a very important system for us to understand, given we're going to be meeting people and talking to them about their health and wellness. So what do we need to do? Pre-screening. So I know you haven't heard of lots of these issues, but even just asking the question, any history of kidney problems, any current history problems with the urinary system is really, really important, because once we know what they have, we can find out, is it acute and do we need to change anything? So incontinence, not a pathology, but it's something that's very common, especially in elderly patients. And some people may have adult diapers in place or catheters in place. So having that sensitivity towards the client, and not necessarily pointing these things out, being aware of it and helping them where needed. Sensitivity is required to frequent urination. So, I've had clients who in the middle of a massage need to get up and go to the toilet, get dressed, go out. It happens. And don't take it personally. It's not necessarily anything to do with your massage. It's just having an awareness that something may be going on within their urinary system. Massage may also increase the production of urination as it increases the volume of interstitial fluids in the bloodstream, and that in turn can increase the urine volume. So it's quite often people will need to urinate after a massage. Research also shows that massage can increase the nitrogenous wastes and other ions in the urine. And again, I think now you can see that link to why we don't want to be massaging some of these acute problems where we're having issues with filtration. People who mention they've got pain and urination but don't have a diagnosed condition, you should refer them to their GP, or at least suggest they see their GP and get that checked out, as they may not realise how important kidney and what they see, urine production and urination, as being so important to the rest of the systems of their body. And then finally, here's the list of references from today. So it's chapter 12 in your Massage Connection book. Again, where you can get the latest information on contraindications for all of these conditions. And you can find those right here.